Blood clots, silent and often unnoticed, pose a significant threat to this delicate balance. These clots are akin to unwelcome intruders in the body's intricate network of blood vessels, capable of causing havoc if left unchecked. The Centers for Disease Control and Prevention estimate that different types of blood clots affect up to 900,000 Americans each year. In fact, approximately 100,000 Americans annually die due to this condition. Because of this, knowing the early warning signs of blood clots becomes very important. In today's video, we will dive into the 10 warning signs of blood clots you must never ignore. But before we start, let's first understand the issue a little more. A blood clot becomes an issue primarily due to its potential to block the flow of blood through veins and arteries, which is essential for transporting oxygen and nutrients to various parts of the body. This blockage may result in serious health problems, depending on where the clot forms and where it travels if it becomes dislodged. 1. Ischemia. Blood clots may cause ischemia, a condition where blood flow, and thus oxygen, is restricted or reduced in a part of the body. Ischemic events may lead to tissue damage or death. 2. Deep vein thrombosis (DVT). These are blood clots that typically form in the deep veins of the legs. If untreated, they may cause pain, swelling, and complications such as post-thrombotic syndrome. 3. Pulmonary embolism (PE). This occurs when a blood clot breaks loose from a vein, travels through the heart, and lodges in the lungs. It may become life-threatening, causing shortness of breath, chest pain, and even sudden death. 4. Stroke. A blood clot that blocks blood flow to a part of the brain may lead to a stroke. Strokes may result in significant brain damage, affecting speech, movement, and memory. In severe cases, strokes may be fatal. 5. Myocardial infarction, heart attack. Blood clots may also block the flow of blood to the heart, leading to a heart attack. This may cause permanent damage to the heart muscle, affecting the heart's ability to pump blood efficiently throughout the body. Now, let's find out the symptoms of blood clots. 1. Swelling in one limb. In the case of deep vein thrombosis (DVT), the clot forms in the deeper, larger veins of the leg, where blood is supposed to be efficiently returned to the heart. As the clot thickens and grows, it hampers the blood's return journey. This blockage increases pressure in the vein behind the clot. This pressure forces fluid to seep out of the veins and into the surrounding tissue, leading to swelling in the affected limb. Moreover, the body, recognizing something is amiss, sends more blood to the area in an attempt to supply oxygen and remove waste products. This well-meaning response by the body further exacerbates the swelling, as the additional blood volume increases the pressure even more. Elevation of the leg with some flexion at the knee helps reduce swelling. Early mobilization is beneficial, and the use of graded compression stockings achieves a 60% reduction in post-thrombotic syndrome. 2. Pain or tenderness in the leg. Deep vein thrombosis usually occurs in the lower leg. It often goes unnoticed and dissolves on its own, but it may cause symptoms like pain and tenderness. But the real question is how. Initially, the clot forms as a response to various triggers, be it injury, immobility, or certain genetic conditions leading to an abnormal coagulation of blood. However, the changes in blood consistency increase the pressure inside the vein. Veins aren't meant to withstand such stretching without consequence. This undue pressure irritates the vein's walls, leading to inflammation. It's this inflammation that manifests as pain or tenderness in the leg. Furthermore, this inflammation may make the leg feel warm and appear redder as the body increases the flow of blood to the affected area in an attempt to heal and maintain tissue health despite the blockage. The pain might start out as mild and worsen over time, particularly when standing or walking. 3. Red or discolored skin. The skin, the body's largest organ, becomes a canvas, displaying the repercussions of disturbed blood flow beneath its surface. At the heart of this issue is the blood clot itself, which acts like a barrier within a vein, usually in the leg. This blockade halts the smooth transit of blood, causing a traffic jam in the circulatory system. Blood cells and fluids start to accumulate behind the clot, leading to increased pressure in the vein. This pressure forces some of the blood, along with its cellular components, to seep out of the vein and into the surrounding tissues. As blood components escape into the tissue, they bring with them red blood cells, which are responsible for carrying oxygen and giving blood its red color. When these cells degrade outside of the veins, they release hemoglobin, which then breaks down into bilirubin and iron, substances that may tint the skin in shades of red, purple, or even blue. Blood clots in the skin's tiny blood vessels are the cause of livedoid vasculopathy, a condition that results in skin discoloration. These blood clots may only be seen under the microscope after a skin biopsy. These blood clots cut off the flow of oxygen to the skin, causing the skin tissue to die and form ulcers. 4. Rapid heartbeat. A 2023 review notes that atrial fibrillation, an irregular and often very rapid heart rhythm, is a significant cause of blood clots. In this condition, an individual's atria, the heart's two upper chambers, beat irregularly. This means blood may stagnate within them, eventually forming a clot. A rapid heartbeat, medically known as tachycardia, is the body's attempt to compensate for the disruptions caused by the clot. A pulmonary embolism occurs when a blood clot, often originating in the deep veins of the leg, travels through the bloodstream and lodges in the lungs. This blockade within the pulmonary arteries restricts blood flow, dramatically reducing the capacity of the lungs to oxygenate blood. The body, sensing a drop in oxygen levels, triggers a cascade of responses. The heart plays a central role in this emergency protocol. To counteract the reduced oxygenation, the heart attempts to pump blood more rapidly, hoping to circulate the available oxygen to vital organs more efficiently. This increased workload manifests as a rapid heartbeat. 5. Chest pain that intensifies with deep breaths. When individuals with a blood clot experience chest pain that intensifies with deep breaths, it's often a signal of a pulmonary embolism, a serious condition where a clot blocks blood vessels in the lungs. The clot in the lungs' arteries blocks the blood's ability to flow freely. The lungs, facing a sudden deficit in blood supply, send out pain signals. The reason this pain sharpens during deep breaths is because breathing movements increase the strain on the pulmonary arteries, exacerbating the discomfort from the blockage. This chest pain, known medically as pleuritic pain, is a critical warning sign. A 2022 article notes that the mortality rate for coronary thrombosis in the United States is 10 to 12%. Fortunately, the rates of survival have risen in recent years. 6. Severe headache or blurred vision. The brain, with its intricate network of blood vessels, is highly sensitive to changes in blood flow. When a clot impedes this flow, pressure builds up in the areas of the brain that are still receiving blood, causing a headache. This isn't an ordinary headache, but one that may be alarmingly severe, often described as the worst headache of one's life. Simultaneously, if the clot affects areas of the brain responsible for vision, or if the pressure interferes with the optic nerve, blurred vision occurs. The brain's inability to receive and process visual information correctly leads to this distortion. A study reported visual impairment in 13% of patients with cerebral venous thrombosis, with severe visual loss occurring in about 2%. 7. Speech difficulties. The brain, a hub of neural activity, relies on a constant supply of oxygen-rich blood to function properly. Each region of the brain has a dedicated role, with specific areas like Broca's and Wernicke's areas being pivotal for speech production and comprehension. When a clot blocks the flow of blood to these areas, it effectively cuts off the oxygen supply. Without oxygen, the affected brain cells begin to suffer and, if the blockage persists, may die, disrupting the neural pathways essential for speech and language. The manifestation of speech difficulties may vary, ranging from slurred speech, known medically as dysarthria, where a person knows what they want to say but struggles to articulate words correctly, to aphasia, where the ability to speak, read, write, or understand language is impaired. For instance, aphasia has been observed in almost 20% of patients who have suffered cerebral venous and dural sinus thrombosis. 8. Sudden weakness or numbness. At the core of this phenomenon is a blood clot that obstructs a blood vessel in the brain, an event commonly known as an ischemic stroke. The brain, a command center for the body's functions, relies on a network of blood vessels to provide it with oxygen-rich blood. Each area of the brain has a dedicated function, including regions that govern movement and sensation. When a clot blocks the artery feeding these regions, it cuts off the essential supply of oxygen and nutrients. This blockade initiates a cascade of failures in cellular processes, leading to the death of brain cells. But the immediate consequence is a loss of function in the areas controlled by the affected part of the brain. If the clot impedes blood flow to the region responsible for arm and leg movement, the individual may experience sudden weakness or even paralysis in these limbs. If thrombosis occurs in one of the cerebral arteries, e.g., ischemic stroke, symptoms may include the acute onset of unilateral or bilateral weakness. 9. Pain in the abdomen. The story begins when a blood clot forms in the mesenteric veins, a critical part of the circulatory system that drains blood from the intestines. Once a clot forms, it acts as a barrier, obstructing the flow of blood away from the intestines. With the blood flow impeded, the intestines begin to experience ischemia, a condition characterized by a lack of oxygen and nutrients. The affected segment of the intestine starts to suffer from this deprivation. The body's response to this distress is to signal pain. The pain is the body's way of indicating that the tissues are not receiving the necessary blood supply, and it may range from mild to severe, often escalating as the condition progresses. This discomfort is typically concentrated in the abdomen because that's where the ischemia is occurring. Studies indicate that subacute thrombosis is an intermediary form of thrombosis in which the patient has abdominal pain and other intestinal symptoms. 10. Excessive sweating. A blood clot, such as a pulmonary embolism, poses a significant challenge to the body's circulatory and respiratory systems. This is where the sympathetic nervous system kicks into high gear, initiating a series of reactions designed to manage the crisis. The sympathetic nervous system, part of the body's autonomic nervous system that controls the fight or flight response, releases adrenaline. This hormone prepares the body to confront or escape from immediate danger. Among its many effects, adrenaline increases heart rate and blood pressure to boost blood flow and oxygen delivery to essential organs. It also stimulates the sweat glands, leading to excessive sweating. Furthermore, excessive sweating in the context of a blood clot, especially a pulmonary embolism, may also be a reaction to the pain and the anxiety that such a condition engenders. Pain, particularly the sharp, acute chest pain associated with pulmonary embolism, may further stimulate the sympathetic nervous system, exacerbating the sweating response. Now let's see how you can mitigate these risks with proper diet. Addressing the diverse symptoms associated with blood clots through dietary choices may be a supportive strategy alongside medical treatment. 1. Pineapple. Pineapple contains bromelain, an enzyme that may help reduce swelling and inflammation. Bromelain has been shown to have effects on reducing edema, inflammation, and pain, making pineapple a beneficial choice for individuals experiencing swelling due to blood clots. About 1 cup of pineapple chunks per day is considered a healthy portion, offering the benefits of bromelain along with vitamin C and manganese. 2. Ginger. Ginger has powerful anti-inflammatory properties, thanks to compounds like gingerol. Consuming ginger may help alleviate pain and tenderness associated with blood clots by inhibiting inflammatory responses in the body. It may be added to foods or consumed as ginger tea. Up to 4 grams of ginger per day in fresh, powdered, or tea form is generally considered safe for most adults. For pregnant women, it's advised not to exceed 1 gram per day. 3. Blueberry. Blueberries are rich in antioxidants and flavonoids, which may help protect skin tissue and reduce inflammation. Blood clot-affected skin may benefit from the nutrients in blueberries in terms of healing and appearance. A standard serving size is about 1 cup of fresh blueberries per day, which provides antioxidants and fiber. 4. Banana. Bananas are an excellent source of potassium, which is essential for heart health. Consuming bananas may help regulate the heartbeat and reduce the risk of heart palpitations, a common symptom when experiencing a blood clot. 1 medium-sized banana per day is a healthy addition to most diets, providing potassium and other vitamins. 5. Flax seeds. Flax seeds are high in omega-3 fatty acids, known for their anti-inflammatory properties. Including flax seeds in the diet may help reduce chest pain associated with blood clots by lowering inflammation in the body. About 1 tablespoon of ground flax seeds per day may offer a significant amount of omega-3 fatty acids and fiber. 6. Pumpkin seeds. Magnesium-rich foods, such as pumpkin seeds, are beneficial for preventing and alleviating headaches. Magnesium deficiency is often linked to headaches and migraines, so incorporating pumpkin seeds may be helpful. A daily serving of about 1/4 cup of pumpkin seeds is a good source of magnesium, zinc, and healthy fats. 7. Fatty fish. Fatty fish like salmon are high in omega-3 fatty acids, which support brain health. Salmon consumption may aid in the recovery of blood clot-affected brain function, potentially easing speech difficulties. Eating 2 servings of fatty fish like salmon per week is recommended, where 1 serving is approximately 3.5 ounces cooked. 8. Beets. Beets are high in nitrates, which improve blood flow throughout the body, including to the brain. Improved blood flow may help reduce symptoms like weakness or numbness caused by blood clots. Consuming about 1 cup of cooked beets or beet juice per day may provide nutritional benefits without excessive sugar intake. 9. Yogurt. Yogurt contains probiotics, which may help maintain gut health and reduce abdominal pain. The live cultures in yogurt may aid in digestion and alleviate discomfort associated with blood clots in the abdomen. Eating 1 serving of yogurt, which is typically about 1 cup per day, may contribute to a healthy gut microbiome. 10. Watermelon. Watermelon is hydrating and contains magnesium, which may help regulate body temperature and reduce excessive sweating. Its high water content may keep you hydrated, potentially mitigating sweating symptoms. About 1 to 2 cups of diced watermelon per day is a refreshing way to stay hydrated and get additional nutrients like vitamin C and lycopene. Understanding these signs and their connections to the body's circulatory system is crucial. If you experience any of these symptoms, especially in combination, seek medical attention immediately. Remember that blood clots are hard to detect without knowing their symptoms. Early detection and treatment of blood clots may prevent serious complications and save lives. In today's video, we learned about all the signs that you may experience if you have developed blood clots, along with some amazing fruits that may help you mitigate the risks.